It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, federal funding for science has been shrinking, so it's big news when the National Institutes of Health renews a grant of $33 million, and even bigger news when the goal is to make Indiana a healthy state. Barbara Lewis has more in the Business of Health. Barb?
That is a big mission indeed.
Yep.
Gary, thank you. Well, the grant was awarded to the Indiana Clinical Translational Sciences Institute. CTSI is a collaboration among Indiana's top universities. The statewide network's ambitious goal is to improve our state's current dismal health rankings in the areas of infant mortality, addiction, and tobacco use. So joining me now is the director of the Indiana Clinical and Translational Sciences Institute, Dr. Anantha Shekhar. It's always good to have you on the program.
Thank you, Barb. It's a pleasure to be here.
So, wonderful news. This is rare indeed. What do you think it is about what you're doing that had the NIH respond so enthusiastically?
Well, I think part of it is that we have great university partnerships here. Indiana, Purdue, and Notre Dame have come together in a very strong way to create this institute. But we also have amazing partnerships across the states with corporations, health systems, IO Health, Eli Lilly, Roche, other big companies also being part of this. So it's a great ecosystem that actually collaborates and creates this institute.
It's kind of a two-part question, if you will, and I want to know about the impact. First, let's talk a little bit about Indiana University, and then the impact on Hoosiers in general. So let's start with IU.
For IU, this is the largest ever grant that the National Institute of Health has given to IU. So in that sense, it is a big endorsement of IU as an emerging research excellent institution in the country. And it also sort of gives us a lot of infrastructure to build more grants and provide more federal programs here for research. So I think for IU, it's a great, I would say, a positive news that this has created for us.
Okay. And before we talk a little bit, go into detail about the impact that this may have on Hoosiers, when we think about what's at the core of all these problems, I mean, poverty is really kind of at the root of this. So are you treating the symptoms here rather than the root cause?
And I think that's a great question, and it's certainly a point that we are very cognizant of. When we look at these health problems, whether it's infant mortality or addictions or other kinds of chronic health problems, a big challenge is not just access to health care, but it's really ability to afford just normal, healthy lifestyle. So poverty is a big issue. Resources and safety net requirements are a big issue. As an example, one of the things that we ran into in our infant mortality project is not just so much that these mothers didn't have prenatal care, but they also had other problems that were even worse, like food insecurity and housing insecurity, which are much greater sort of challenges in terms of the infant's outcome.
Okay. So using either infant mortality as an example or another one of the programs, where are you now and where do you hope to be?
I think right now we are in the stage of beginning to map out what our current challenges are and what are the resources that are available in the community and who are the people that are already working in these communities to address some of these problems. So once we have a complete map of that or an environmental scan of that activity, what we hope to do is facilitate a lot of the activities further and bring our own new programs. So these funds will be used to create a much better coordinated program, we hope.
Okay, well, Dr. Shekhar, we really hope that you do well, and I'm so glad to have you here on this program, especially today.
Thank you so much. It's always a pleasure to be here.